There are new concerns spreading about a polio comeback.
It's been 43 years since we've seen polio here in the U.S., but now someone is paralyzed in New York from polio, and the virus is showing up in wastewater. Dr. Wally Wazni is a neurologist and the medical director of the community clinic at Dignity Health St. Mary. Dr. Wazni, thanks for joining us.
Thank you for having me.
Remind us again of the symptoms of polio and how do they think this person in New York became infected?
Yeah, so, the symptoms of polio actually, about 90% of people who get infected with the polio virus are actually asymptomatic. So they actually have no symptoms at all. There's about 10% of the population who get symptoms, and those are just, flu-like symptoms, but there is a 1% of those patients who do get polio virus develop what we call ascending paralysis. And so they become weak in the arms and the legs and sometimes in the face.
I wonder why this is happening now. And Dr. Wazni, obviously this is a case that happened in New York. Should we be concerned out here?
Really, I really don't think so. We did eradicate, the naturally occurring polio. So what we're seeing in New York City is actually what we call a vaccine polio virus. So that's from the oral polio virus, which we don't give in the U.S. anymore. So in about 2000s, we stopped giving it. And what that oral virus is, the vaccine is a attenuated virus. And that virus actually infects the patients. And that's how it gets spread. This latest one from New York is we traced it back to Israel. So Israel's still giving the oral vaccine, and that causes the spread of the virus.
How concerned should we be that polio is showing up in this day and age?
I think, it doesn't have the world pandemic or epidemic concern that it was when it first, was the big scare in the early 50s, 60s, and 70s because of the vaccine. The vaccine is very effective. And I think that, if we look at more of the demographics in this New York area, a lot of the people in that area aren't vaccinated. So to protect ourselves from this, very rare circulating form of the oral vaccine-derived virus, if we're vaccinated, it's over 99% effective.
Is it ever too late to get vaccinated?
No, it's not too late. And actually, even if you're vaccinated as a child and you're traveling to a high-risk country, so the only two countries left in the world that are that the virus is not eradicated is Afghanistan or Pakistan. So if you're traveling to those countries, or if you're immunosuppressed, we do recommend one booster shot as an adult.
Dr. Wazni, thank you for joining us this afternoon. It's always good to see you.
Thank you for having me.
We'll continue our coverage on